later on. When you see a peak in number of cases, it doesn't always translate immediately to death because people are sick, they go to the hospital, then they start dying subsequently. So I think that is why you have the number of the new cases increasing and declining, and then the number of deaths followed a little bit, takes time before they decline. They'll subsequently decline if we don't have outbursts. In terms of testing, about 95 million, I beg your pardon, total number of tests have been conducted, with last week about 1.1 million tests conducted cumulatively. The case positivity rate on them remains high at about 11%. With regards to vaccine supplies, a total of 597 million doses of vaccines have been delivered in 54 member states. And of that number, 380 million doses have been administered. That is representing 64% of the overall doses. For those who have received full immunization, that is the 2 doses of the vaccines or the 1 shot from the Johnson & Johnson, about 11.3% of the population are now fully vaccinated. Egypt has fully vaccinated about 25.8% of its population, Morocco 62.5%, South Africa 28%, Mozambique 31%. And I think that those are just to always give you an indication that some progress is being made in some countries, and the situation of the average of 11% is really like averaging everything that is going on in the 55 member states. A total of 37 million doses of Johnson & Johnson vaccines have now been delivered, and the MasterCard donations are beginning to hit the member states with about 12.8 million doses in kind donated by member states through by the MasterCard Foundation / Africa CDC collaboration donated through the AVAT. And now about the initiative that is in the process of launching. I've said earlier this year that there are 4 axes of focus for the continent to fight this pandemic. One is vaccination, increase and scale up of vaccination, because as I indicated earlier, vaccines are becoming readily available on the continent. The second is the testing. How do we scale up testing? And then that leads to treatment, which is the third, and then the prevention measures there. So I'm very pleased to say that in order to increase our vaccination efforts, we will be launching a campaign with the youths. We're calling it African Youth for COVID-19 Vaccination Initiative for Saving Lives, Saving Livelihoods, which is part of that overall umbrella initiative. So again, the initiative will be the African Youth for COVID-19 Vaccination Initiative. And our youth envoy was supposed to be here to expand on that, but she is caught in traffic. We are hoping that in course of this discussion, she will be able to join. It will be an important initiative because we have to recognize that the median age of the population in Africa is about 19 and a half years. So many young people constitute the population of the continent, and at least 70% of the population is less than 30 years old. So we really have to youths to play an active role in scaling up of the vaccination in terms of mobilizing their peers and reach out. So that is why that initiative is, we believe, is very, very, very important and very timely. The second thing that we would like to launch is an initiative that will begin to create an opportunity in this very early phase to attract Africans who are in the diaspora to come back and support our efforts in the pandemic response going forward. They have been doing an amazing job supporting, but online, but we are looking for opportunities to create an enabling environment so that they can come spend 3 months to 6 months in a rotation program, which we'll call it the Kofi Annan Scholar Program. If you all recall, we launched the Kofi Annan program, which has 3 pillars. One is the Global Leadership Program, and we've graduated the first cohort and recruited the second cohort. The Scholar Program had not started, and so this will be an opportunity to start that Scholar Program where you get an African who is somewhere out of the continent and wishes to contribute. We work with us, we facilitate that, pay for their tickets, their living expenses, and they can come, and we embed them in one of the National Public Health Institutes. So that is the second. The last initiative is really what we are calling democratizing rapid testing, where we really are going to be promoting and launching a self-testing campaign so that the communities and the population take ownership of their own testing and take the appropriate measures. If we do that, we believe, and democratize self-testing, it will provide an enabling environment for people to know their status. And if they know their status, they can take appropriate measures to stay home, protect themselves, protect their loved ones, and protect their communities. So even if they go out, they make sure they're aware that they're positive and they can actually take appropriate measures there. I think that is the direction Africa CDC is going. So in the coming weeks and days, you begin to hear more about these initiatives, and we'll do proper formal launching of each of these initiatives in partnership, of course, with other our usual partners and donors that we are working with. So Wayne, thank you. Those are the updates. As I said, you will be contacted to announce that it will be a special briefing during this summit after the head of states have at least provided some guidelines and direction. Over to you, Wayne.
Thank you very much. That was Dr. John Nkengasong of the Africa CDC. It is now time for our question and answer session. And before we move into that, let me just give you that WhatsApp number. It is +251 94 550 2310. +251 94 550 2310. Alternatively, you can come through on our question and answer section, as well as come through live, as Paul Adepoju has done. Paul, good morning. Please go ahead with your question.
Hello, good morning, and thanks for this opportunity to ask my question. So the first question I have has to do with testing. And I remember 2 weeks ago, Dr. John said the continent is not facing any testing shortage. But a letter that was sent to WHO this week showed that huge gaps still exist in testing. For instance, the proportion of testing being done in Africa in comparison to the rest of the world. So while you've announced a number of initiatives to rapidly improve vaccine coverage, I would like to know your thoughts regarding the gap that still seems to exist regarding COVID testing too. Then the second question I have has to do with inquiry regarding the youth focus initiative that you've announced. Do we have available data on the demography of COVID-19 vaccination, maybe age groups, vaccination coverage across age groups, which can provide better indication of the priority? Then my last question is, what do you expect out of the AU event that is happening? And if you can comment on the African Medicines Agency agenda, do we have any indication of whether this particular session is going to bring any advancement in that issue, in addition to what the Africa CDC expects from the event? Thank you.
Thank you, Paul. All extremely valuable questions. In terms of COVID testing, let us be very clear. From where we sit, we have seen a remarkable change and improvement in access to testing. I mean, let me just use the African Union and Africa CDC as an example. We are here in the middle of the AU summit, and we are characterizing it as a COVID-free summit, which means that every day, and I mean every day, we conduct testing. okay, we conduct testing on all the delegates that come into this compound and those are thousands of people that are conducted. And we have not run out of tests. So it always shows you that if people are, countries are really keen and wanted to take up the guidelines that we are giving them, they will find testing. I think we have not struggled with access to tests. The key is at the country level, are they prioritizing the testing, which I think we at Africa CDC is saying that it's a cornerstone. You heard me, Paul, define the 4 different axes of focus in 2022. Testing is key because that is, if we have to have access to treatment, you have to test so that people test and they actually can get some treatment like the Paxlovid and Molnupiravir, all drugs that are coming up, and we are negotiating with all of this. So again, testing will continue to be a key. We see the test numbers fluctuate. Some weeks you have a very high increase in testing, and then the following week you see a decrease. But that doesn't necessarily reflect lack of tests. It reflects the testing itself. Countries actually engage in testing, or they are doing selective testing, which most of the case is about people who have symptoms or people who are trying to travel or in some settings, but it's not been really systematic testing going on. So this your second question on vaccination. Needless to explain what I said earlier, or to expand on that our population structure speaks to a very young population, and unless we engage the youths into this campaign, we'll be missing out a lot because they may end up being a population that is not fully vaccinated and will be the reservoir for the rest of their communities. So I don't have the data yet on the age-specific vaccination, but that is something that I will ask my team to engage a vaccination unit so that they can actually analyze the data in that direction and see and stratify it by age group so that we can actually share the information with you subsequently. So I think this is a point well noted that I'm directing to my own team. The expectation from the AU event, on Saturday, President Ramaphosa, who is the COVID champion, and of course, the President of the Republic of South Africa, will be presenting a very comprehensive COVID report. The COVID report will cover several aspects, but again, I don't want to preempt his report, but once he presents that report, immediately following that, we will have a press conference to expand on that and discuss it further. But expect that, just to give you some highlight, that the issues related to vaccination will be take high priority in the discussion. How do we work with the head of state to really galvanize the continent so that they can actually continue to show leadership in expanding vaccination in their country so that we get to the 70% target. On AMA, AMA doesn't come into the jurisdiction of Africa CDC, so I'll unfortunately not be able to speak on the issues of AMA, but suffice to say that it has been ratified, the treaty has been ratified thanks to the extraordinary work that Michel Sidibé did. The next steps will be discussed during this meeting, but again, I'm not privileged to much information on AMA issues.
All right, thank you very much, John. We go now to questions that are coming through on our question and answer section. And these are both from Reuters. So let me start with James Macharia Chege. James says, on Monday, South Africa changed its isolation guidance, saying that those who test positive for COVID-19 but have no symptoms do not need to isolate. Preliminary findings from 2 South African clinical trials suggest that the Omicron variant has a much higher rate of asymptomatic carriage than earlier variants. Then his questions, and he has 2. What is your take on the decision by the South African government? And do you think that the South African government is playing with fire? Now, related to that is Alexander Winning's questions, and Alexander is also with Reuters. So she says, The regulatory provision for social distancing of 1 meter for learners in schools in South Africa has also been removed. Is this throwing caution to the wind? And secondly, last week you said we are still in a pandemic mode and not endemic with COVID-19. Do you think that the new rules in South Africa suggest that we are approaching endemic status in that country? So those are two very related questions from colleagues at Reuters.
No, sure. Extremely important questions. And let me confess that I have not seen the guidelines in South Africa. And again, you agree with me that it is very, very, it would not be appropriate to discuss guidelines that you have not seen. And the risk is that you may be talking out of context. For example, I don't know what was actually said in the guidelines with respect to being asymptomatic and not isolating, things like that. And also the 1 meter, I'm sure that the guidelines do not just say that if you are symptomatic, you don't get isolated. There must be a text that provides a rationale behind that. So I would ask my team to pull out those guidelines so that we can read them and hopefully discuss it more on Saturday. Again, just being as cautious as possible that we do not jump into conclusions from outside without the full knowledge of what the guidelines have said. So you take it from me that we will look into that and get back to you. Let me just repeat what I said last week. We are still in the pandemic. And the concept of that that if something is not done, we go into an endemic situation, I think is creating communication challenges in what you really mean by an endemic disease. Let me again provide some definitions around that. You speak of an endemic situation where you have brought down the burden of the disease to a certain level, a minimum level that you can cope with in the community, and that you only begin to see sporadic occurrence of that situation. That is what you really mean in public health by endemicity. I think I really want that definition to be clear. But if today we say that with 11% positivity rate and the severity of what we are seeing now, that is the waves that keep coming and going, we have now moved into an endemic situation. That it doesn't meet the definition of endemicity. It only means that we've admitted that we are going to live with that pandemic, okay, for long. So that is just what it means. It means that we have failed to control the pandemic. We are living with a pandemic. It's very different from saying that it is an endemic situation. I just want to clarify that those definitions there. So no, it is in no one's interest that we admit that we are going to be living with a situation where we are dealing with 11% positivity rate for COVID. It is disruptive. It's still killing. We know many people, that loved ones around us that have died because of this virus. So the pandemic is here, and it is as brutal as it was a few months ago in terms of people that are being killed from this pandemic. Within the commission itself, we've had colleagues that have died just recently because of COVID. So I think we are taking it very, very seriously. And that is why we are very aggressive during this conference to ensure that we conduct what we are calling a COVID-free summit, and we test every day. And I would be happy to tell you that just yesterday, when the summit started with the ministers of foreign affairs, we captured 4 cases out of the 1,000 that we tested. But imagine if we didn't test those 4, and they were all moving around in the conference, they would be infecting others. So I think because of that systematic screening, we are rooting out those that have been infected, and then they self-isolate. And within the next couple of days, I'm sure they will repeat their test, and they should be able to contribute or to travel back to their respective countries.
All right, thank you very much for that detail. Let's go to our WhatsApp platform and say hello to Liane Dibaso. Liane doesn't tell us from which country, but she's with Bloomberg. And she says, do you have any new information or data on the new Omicron sub-variant?
No, we do not. And I was just requesting for that information today from the team. And if you send us your address, I'm sure that once the analysis is done, you will have that. One of the things we need to be, I just want to make sure that is clear, is that we do not, we verify, re-verify, and verify all information. So it takes time to collect from member states, do the verification, so that when we put the information out there, it is the accurate information that we are sharing. So we've not had the good fortune of analyzing and knowing what the the Omicron BA.2 is, the extent of the spread. But that information shouldn't be difficult for us to get in the coming days.
All right, so thank you very much. Hello to Sarah Jerving. You want to come through live? Sarah, please go ahead.
Thanks so much. Where are the resources coming for these 3 initiatives, and where do the self-tests come from? Will there be pooled procurement? How will you increase acceptance among the youth? What will be the strategies around that? And how will you recruit the diaspora? Thank you.
No, sure. I mean, the self-testing is, we will be issuing guidance on this in the coming days. You see us send out like a 1-pager to define what we're doing, then subsequently a full guidance will go to countries. I think our South Africa CDC will procure tests to support countries as we have been doing. I think we have President Ramaphosa will be giving this number tomorrow. About 16 million antigen tests have actually been rolled out in the last couple of months by Africa CDC. But we do not and have never pretended to replace countries. All we're doing as a public health agency is to demonstrate that it can be done. And then we expect that countries will pick that up and work with their partners to implement those guidance that we put out there, those policy guidance. So again, the short answer to your question is that we will procure as best as we can, support countries, but then expect that countries will follow the guidance that we are providing, as they have done all through this pandemic. And that, again, is an area of interface where the youth program can help, the vaccination program. In terms of resources, remember we have a very strong partnership with the MasterCard Foundation. It's a $1.5 billion partnership entitled Saving Lives, Saving Livelihoods. So anything that we can do to increase vaccination uptake can be supported within the context of that program. And that will include, of course, this youth program that we are will be launching. I really hope that the youth envoy will be here, will join us to say a few words to you all, so that you can see the excitement that is characterizing this new initiative. We believe strongly in it, and I'm passionate and hopeful that it can truly be transformational in the way that we engage youth to contribute in the vaccination exercise. I think those were the 2 questions, right?
Yes, yes. All right, we move on to Judith Akolo, and Judith is with Kenya Broadcasting Corporation in Nairobi. She says, Dr. Nkengasong, thank you for clarifying on why we are seeing more deaths, yet the number of cases is coming down. However, I have 2 questions. First, did we really succeed on the social aspect of helping to sensitize the public on the need to prevent COVID-19 transmission? Then secondly, what will make the youth join in the efforts to get vaccinated when they are the ones that still went to villages, even after being told that they might compromise the health of the elderly? And they're also the ones that have continuously put on face masks only when they see the police.
So, Judith, as always, very good questions. I think, have we succeeded in implementing public health measures with respect to the public engagement? I think the answer is largely yes. But you also have to admit that we've lived with this pandemic now for 2 years, and there's been a considerable waning of compliance with public health measures. I mean, that we see that every day. You see it in Nairobi or wherever you are in Kenya. I see it across the continent. In Ethiopia, for example, when this pandemic just started, I used to drive around the city of Addis just on the weekends just to see myself how many people were masking. Of course, you don't see that a lot of masking the way that it was early on, and you can fully explain this because of what we call the pandemic fatigue, the prevention fatigue of people wearing masks all the time, and just the fact that the pandemic has gone on for 2 years. But it is not because we are tired that the pandemic is tired. The pandemic is here with us. The virus is circulating, it's in the community. So my appeal to the population is still the 4 things that we put forward there. Prevention, using social distancing as much as possible, washing of hands, wearing of masks, support vaccination, support treatment, and testing there. So those are the key elements that we know they work against all variants. I think, so again, my appeal to the public is that if you offer the virus an opportunity, it will spread. And another thing I must say, Judith, is that we are making good progress with the fight yet. Just 2 years ago, it was almost unimaginable that we'll have a summit, a face-to-face summit here in the Mandela Hall. 2 years ago, or 1.5 years ago, it was impossible to believe that we can organize the African Nation Cup in Cameroon. But we are doing that with full backing of the new interventions that have come in, i.e. vaccines and the testing. As we speak, African CDC has a large team in Cameroon that is working with the Confederation of African Football, the CAF, to support the daily testing. And to when people get into the stadium, testing is done. Africa CDC is there supporting. Vaccination is being done. And we have seen a rapid uptake of vaccination in Cameroon during this period of the African Nation Cup. Those are all measures that are being put in place to supplement the public health measures that we've lived with for 2 years. And clearly the population is getting tired because of that. In terms of youth sensitization, absolutely, it is exactly because of the reasons that you mentioned that we must engage the youth. Okay, I mean, in public health, you have to solve the problem with the population and not without the population. So if we see that there are challenges in the youth population, we have to engage them. How we'll do this, we'll engage directly, talk to the population, the youth population, and they themselves will guide us with respect to what we can do in the population. If we develop champions within the youth population, they'll tell us what to do, share some cultural context and the sociology that governs those communities. And no one community is the same. That's why this youth program will enable us to reach out to many countries and work with them so that we can develop key messaging that will be context specific and not just develop a broad guidelines for such efforts there. So again, the youths might be problematic, but I remain optimistic like any public health challenge that by engaging them, creating champions and sustaining our communication efforts with them, they will actually begin to we can turn them around and they work for us and become the agents of change for this vaccination and testing.
Thank you very much, John. Over now to Sarah Kimani, who is with SABC News. And Sarah says, at what point will Africa join the rest of the world in going on with life as normal, including doing away with face masks?
I think that is a very interesting question. I'm also very keen to see not just Africa, but the world return to normal. But COVID, as we all know, has changed the world in a significant way. And shall we be returning to normal anytime soon? I doubt. But I think vaccination will continue to be evidence that people have been vaccinated will continue to be guide the way we behave. I think there are many places now in the developed world that require, including restaurants, require that you show evidence of vaccination. I don't call that a normalcy. That is not what we were doing 2.5 years ago. So even if the COVID is gone, you still, in the next coming years, be required that certain things remain in place, like testing, like a vaccination. I think we've now lived with the fact that you don't get up in the morning and book a flight to travel to Nairobi or to Zimbabwe. You have to first of all think about my COVID test, right? That is not what we were doing 2.5 years ago. I mean, that has now become part of our lives, that you just kind of think of when you do your COVID test so that it doesn't expire before you get into the travel. So life will get to normal, but I doubt that it will get into absolute normalcy as we were 2.5 years ago or 3 years ago.
We have a question that's coming through from Mohammed Hassan, and Mohammed is with Al Ain News. And he's asking what preparations have been made to prevent the spread of the coronavirus for this summit. I know you touched on it earlier a little bit, but perhaps you might have more detail on that.
No, sure. I mean, there have been several, we studied the situation very, very carefully before providing our advisory. I mean, Africa CDC doesn't propose to head of state for them to organize the summit. We provide the scientific evidence and then the technical advisory, and they use the advisory to make a decision. So this is what we told them. We said we have more tools today to fight the pandemic than we had 1 year ago. For example, the N19 mask, we have it now. Everyone at the summit is coming in with an N19 mask. This is mine. And everybody in this room have theirs. And if you go into the Mandela room, there everybody has the N95 mask. I think that is important. Because that will help prevent the transmission of even the most transmissible variant like the Omicron. So I think that is key. Second, we said the vaccination situation has changed. I mean, now most delegates that are coming in have been vaccinated. Okay, I think that is also that is a factor that we put into play. Third, access to testing has changed. Okay, antigen testing, we are doing it. There are several tents going on within this summit. There are several locations within the AU compound that you can do testing, and it takes less than 15 minutes to do. So people come in very early, they test, then they get into the conference setting there. So, and that's where the data was telling you that yesterday we picked up 4 cases, and then today 7 cases came from. And if you look at it, and the large number of people that are here, and the relatively small, the 4 and 7 cases there is really impressive that the measures that we put in place are working, right? So I think all of that. Then reduction in the delegation. So instead of having a large delegations coming from member states, it has been a very reduced number of delegates that are coming from the different member states. And then, of course, we are avoiding large crowds as much as possible. Like in this room, this is a large room. We are only 5 of us in this room. So I think that is, those are some measures that we are putting in place. And you can see the distance between myself and Winnie. And it shows you that this is what we are doing, including in the room, the Mandela Hall there's little spacing. I mean, people sit and there's a gap of about 1 meter away before the next delegate sits. So those are all measures, a package of measures that we have put in place to ensure a COVID-free summit. And we are very encouraged with the data that we are seeing in terms of the positivity rate.
All right, thank you very much. We say hello to Chinedu Asadu, and Chinedu is with the Associated Press. Chinedu says, my question to the director, how effective have vaccine mandates been in boosting vaccination rates in African countries? And have you seen any pushback from the population or from any legal provisions or legal challenges?
I don't have we don't have the information, to back those questions. So I prefer not to address that question for now, but it's a very valid question to know if that has led to any increase in the uptake of vaccines. And I don't recall, I know there are certain countries that the legal departments push back against vaccine mandate on the continent, and I don't have that off head, but I don't think there are many countries that have gone down the route in Africa for imposing vaccine mandates in the population.
All right, thank you very much. Hello to Bonisile Makubu from Eswatini. What is Africa's position on PCR testing for traveling? And then she wants to know if there are any countries that are now considering rapid tests for traveling, and if so, which ones? Then she has a second question. fewer people are taking the booster vaccine in Eswatini. What could be the reason, and is it so even in other countries?
So first of all, with the testing, there is the PCR test continues to be a standard, the gold standard for testing. And I would say, unfortunately, so we've got stuck with that, with the PCR test, which is the molecular-based test. The antigen test, the rapid antigen test, are as accurate as the PCR test in most cases. We have seen data that shows a very close correlation between the PCR test and the antigen test. But overall, we cannot, as Africa CDC, make recommendations only for Africa. It has to be, it's something that is done across the world, okay? And that is exactly the niche that the WHO in Geneva should fill, which means that it can really convene a meeting and then look at the results of the antigen test and say, okay, good. If the antigen tests are as good as the PCR test, then we should be able to use antigen tests to travel, because there's no point for us to say that we should use antigen tests, then that is not recognized in London or Paris or Washington. Okay, it will not just help anybody. So those are limitations of certain things we cannot do. And so, but the antigen test results, again, we've seen the data, looks very, very good. Correlation is very, very strong with the PCR testing. And I really hope that we can move even towards that direction. Okay, in the coming in 2022, where we recognize an antigen test as the equivalent of a PCR in terms of performance. With boosters, there is we Africa CDC is currently working on guidance for booster on the continent, and we are looking at the data and we are saying, look, there are three things that we should look at. First, in our guidance should be that is to promote the uptake of even the first dose, because you don't talk of a booster without your first dose. So in the guidance, you see the first recommendation will be go out there, please, and get your first dose. Then those who have received their first dose should get a second dose. Then a booster, that will lead to the question of booster. For those who have been vaccinated, say the last 5 months or 6 months, we know clearly from evidence that the neutralizing antibodies begin to decrease after 5 months or 6 months, but it doesn't necessarily correlate with lack of severity, protection against severity of disease. But at that point, it's a critical junction. So we might actually be saying, look, after 5 months or 6 months, you should consider getting your booster, because your antibody levels must have decreased to a level that it might not give you a more substantive protection against hospitalization or disease. But we will be publishing those guidelines, and very, very soon. Our scientific group is working on that. And again, in the coming weeks, we should expect to see Africa CDC take a position on boosters. That way, at least we standardize our common understanding of when to get a booster on the continent and what we should do to increase the uptake of vaccination.
Thank you very much, John. Let's say hello to John Wesonga. And John says, kindly clarify how the Africa CDC is looking to drive its partnership with the MasterCard Foundation this year. And I guess that John is referring to the Saving Lives, Saving Livelihoods initiative.
No, the Saving Lives, Saving Livelihood initiative, what we call the SLL, has taken up extremely well since we launched it in June last year. We have multiple countries that are already benefiting from this. South Sudan, Tanzania, Uganda, Cameroon, you just had me expand on that, Sierra Leone, and many others have already, we call that phase an emergency intervention phase, where we just send our teams to go out and help countries to clean up any vaccines that had the risk of expiring. I think we are done with that phase. In 2022, you see that we've recruited a large number of partners, both international partners like the UNICEF, the World Food Programme, I might be missing some International Federation of Red Cross, and many continental partners like AMREF to work with us to scale up vaccination in member states. And the vaccines that will be scaled up are any vaccines that are available in country and require that we put in resources to do that. So in sum, the phase one of that program has already started and with very encouraging results. The phase two will start once we go to the final details of what we are doing, what we are calling micro planning, which is sending teams to countries and they look into the details of what actions are needed to boost vaccination. And as we speak, over close to 40 countries have gone through the micro planning process. So that, I mean, we know exactly what is required by who. Again, let me just conclude by saying that Africa CDC and the MasterCard Foundation partnership do not pretend to replace countries. We are only a partner in a whole spectrum of other partners that are working in the country. So we continue to work with WHO, with UNICEF, and others, Gavi, to make sure we coordinate our efforts in country as much as possible. So again, our own responsibility is to, as much as possible, support using the resource envelope that we have and hope that we can coordinate more effectively with other partners.
All right, we come back to Chinedu Asadu, and he says, as more doses are bought and donated, and they continue to arrive in African countries, how are nations coping with the needed infrastructure to distribute these shots, especially considering the increasing need to take the vaccination away from primary healthcare centers and to establish vaccination booths in public places?
There's no one strategy to increase vaccination. I think it is all a combination of strategies. You have to have fixed sites that people can go get vaccines. You have to have mobile vans that move around, and like what we are doing in Cameroon now with what we call the fan zones, where you drive a truck with vaccines and a vaccination team into that fan zone and help with a vaccination. And then, of course, the vaccination centers that are created within hospital settings or at strategic locations. So there's no one formula. We should use a combination of all possible strategies to increase vaccination uptake. So as more vaccines arrive in the countries, I think I answered this already, we should build partnerships and build collaborations with multiple partners to scale that up, so that at the end of 2022, we should exceed actually the 70% target that was set by WHO. As more vaccines are available, it is very possible if we coordinate our efforts and really be very deliberate in the fact that we'll run this as a program and say, look, by May or so, we need to push all countries to get to 40%. And then by December, I'm making up a number here, but we should set targets and that enable us to get to that number. And then slowly we'll get to the 70% if we have to come back to a normalcy, which one of the colleagues was questioning here.
All right. Alex Winning has a second question. She has two, in fact, and it is about the subvariant of Omicron BA2. So she says, how might this variant affect Africa? And can we now say that the Omicron infections have peaked on the continent? Sorry, she has a third one, and she says, what is the data on hospitalizations in particular? So
the new variants or subvariant of Omicron has, this is what we know from studies that have looked at that variant. One is that it has an increased transmissibility. Second is that it doesn't need to, it leads to necessarily to increase death. So it's like the Omicron, the parent Omicron itself. And thirdly is that, I mean, for those who have received their boosters, just like in the original Omicron, that it really helps, provides protection. So we have not seen anything with that new variant that is alarming or is a cause of concern. It again is fully well aligned with the properties that we saw within the original Omicron variant. The second question was,
has Omicron peaked on the
yes, we presented, I don't know if you were yet, we've seen that overall there's been a decrease of about 15% compared to last week, and that is across the board. So I think we have seen the uniqueness of Omicron is that it peaked very quickly and then started decreasing also very quickly. So again, we at Africa CDC, we will start a series of studies to look at do serologic surveys to really look at what percentage of the populations are now have now antibodies against the Omicron, whether vaccine-induced or natural infections. So again, how is that important? I think it begins to tell us the level of population antibody levels that are available, and that may or may not have any implication for the severity of the disease. But unless we study it, we'll continue to speculate. So that is the role of the CDC. Just what we did. You remember some months ago, we shared with you this, data from the serial surveys that we conducted to answer at that time the question, are we underreporting? And the answer is yes, was yes at that time, and we'll publish those findings. And then shift our attention now to what is the level of population immunity, both natural and vaccine-induced, in the continent.
Okay, I don't know if you've responded to the one on the data on hospitalizations.
No, we don't have that data. Besides South Africa, we don't have the data from many other countries specific to Omicron.
Thank you very much. That was Dr. John Nkengasong with the briefing for today. It's time for us to round up and get to hear from him what are the most critical elements that we should be taking away from the briefing today.
I think the first thing, Wayne, is that it is very possible on the continent now, as we have seen with this conference this week, to run a successful COVID-free setting. I think this is so important because as we try to balance between saving lives and saving livelihoods, we have to factor this in, that if you put in those measures that I described, it's very possible to have a meeting like what we just had. And secondly, that events like the African Nation Cup doesn't necessarily need to be what we call a super spreading events if you put in the right measures, okay, the public health measures backed by testing, which Africa CDC is doing. So I think we are learning, and these are new lessons in this pandemic. This is so important because the African Nation Cup has changed the whole dynamic now in Africa, which says that we should respect, if we are disciplined, there are many things that we can do while fighting this pandemic. The summit that is going on also says, it confirms that if you are disciplined and we put in the right measures and we follow that, I mean, that we can actually have a COVID-free summit. Imagine that yesterday, out of the thousands of people that are here, 4 cases were picked up. That is remarkable. Imagine if we have done the testing, about 200 people were infected. That would be a disaster. So I'm very, very pleased with that. Just to, again, the 3 things that I reiterate, the 3 things that I mentioned, the initiatives. One is our partnership with the youths is very important. I think I would like to also ask that we partner with the media to promote this initiative. So partnership with the youth to scale up vaccination is very important. Second is democratizing testing so that people can do self-testing. It will lead to ownership of these testing programs, and also accountability and responsibility for individual health and community health. We're very excited with that. And then lastly was the issue of really developing programs that will continue to encourage Africans who are in the diaspora to come back and support efforts in the COVID response using structured programs like the Kofi Annan Scholar Program, which I'm really pleased that the first phase of that program, which was the leadership cohort, has gone very well, to the extent that we've now recruited a second cohort, and we are training, we'll be training on guiding 20 public health experts and giving them skills in public health leadership and overall leadership. I think those are the key things to take away from this meeting since we are in the summit.
Thank you very much. That was Dr. John Nkengasong, the director of the Africa CDC. As he said, we are most likely to come back to you at the end of this summit after the presentation by President Cyril Ramaphosa, who is championing the response as part of the African Union's efforts. So that will most likely be on Sunday the 6th, because that's when he makes his presentation. But we will be coming back to you with the exact details of time and venue for that. We look forward to you joining us again. And we're also hoping that, as has been announced, that the Youth Envoy will be able to join us at that meeting and make that appeal to young people to get involved in this vaccination campaign. Otherwise, from us, we hope that you will continue joining the proceedings at the AU Summit. We are sending out the links for you to listen in, especially on the opening sessions. So we hope that you're enjoying that, and we'll continue to take part in the different engagements with media that we will be having. But for now, bye-bye.
Thank you, and see you again shortly.